That's why during the scope itself, I usually tell patients that it's pain-free and you don't remember and you're completely knocked
Are
out.
we allowed to tell people it's pain-free?
Some people actually present with extreme loss of weight, non-intentional, because they keep on having this malabsorption. You ask most of the patients who've gone through it, the main thing that they remember about the whole colonoscopy.
Having a good sleep.
Yeah.
I can't even drink on any given day. I can't even drink 4 bottles of water.
Yeah.
Let alone that liquid. Alright, ladies and gentlemen, welcome back to another episode with your favorite doctor. The reason why we have him is because you have questions. So yes, today's episode is a little bit different.
Okay.
It is AMA, Ask Me Anything.
Okay, ask me anything.
I learned that term today only.
Me too. AMA.
AMA. Okay, so first of all, welcome back. Maybe what you'd
thank
like
you.
to do for us is maybe briefly highlight the importance of colorectal health.
Okay, so I guess that is very important because that's what I do. Maybe that's the reason why I'm here as well.
Yeah.
We do know that colorectal cancer is a common cancer. It affects a lot of the males, but as well as the females. If you don't do your cancer prevention, your screening, you don't do your lifestyle changes, you're going to have a pretty high chance of getting cancer. But at the same time, you may also have other conditions. We talk about briefly about hemorrhoids as well as fissures.
Yep.
So those things also affect our day-to-day, I would say, patients who come in to see us.
Yep.
Yeah.
So wait, you're saying that the hemorrhoids
And fissures.
they come in because people don't.
Well, if you don't take like fiber, if you actually don't exercise, those are also risk factors towards hemorrhoids and fissures. Same things, talk about smoking because it's one of the risk factors for cancer, but that could also produce rather predisposed to hemorrhoids as well. Yeah.
How would you summarize colonoscopy?
Okay. Maybe it will be in a few words. It's fast, simple, it's accurate, and it can be done under a pain-free situation. I think that's because most people think that it being a very invasive procedure, it will be awfully painful and it's difficult. It's also something that is gonna be take a long time. But actually it's actually very fast and actually very simple.
Just one morning.
Well, you've done it before,
I've
so
done
you
it many
know.
times.
Yeah.
Unfortunately.
Yeah.
But otherwise, if you're 50 and above, then Singapore recommends.
Yes,
Singapore
so-
government recommends. you do it.
Screening, which is if you're asymptomatic and you're 50 and above, you should get one checked anyway. But if you have symptoms, you're younger of age, the advice is to see a doctor and see whether you need one or you can delay it till later. Yeah.
Got it. So, one question we have here is, what are the main reasons someone might need a colonoscopy?
Okay. So again, we divide that into screening as well as diagnostic purposes because we did mention that. So screening will be for checking for colon cancer, and it will be for patients who are 50 and above, or if you have family history of cancer, or if you have conditions that predispose you to cancer like inflammatory bowel disease. Then for diagnostic purposes, if you have symptoms that do not go away with simple medical treatment, like if you have symptoms, we did mention this before as well, if you have bleeding, if you have change in bowel habits, if you have anemia or you have loss of weight, then you will need colonoscopy and sometimes even other forms of investigations.
But basically, all they got to do is just see a doctor, and the doctor will tell them what to do.
Yes.
Okay.
Exactly.
Doesn't mean every time I got tummy pain, I go colonoscopy lah.
No, that doesn't mean every time you got tummy pain, you go colonoscopy lah.
Got it. Thanks for clarifying.
Yeah.
Okay, so under the category of early detection and prevention, there's a question for how does a colonoscopy help with early detection of colorectal issues?
Okay. So, early detection is under the concept that you have to be able to detect a pre-phase of a condition where you can intervene or you can change its natural history. So in the condition like colorectal cancer, because the pre-phase we mentioned before is the polyp.
Yes.
So that's why if you do a colonoscopy, you
will
see
see
it and you can remove it and then you lead to prevention, and that then leads to the change into the cause of the disease. If you talk about other colorectal issues, now most of the time when it's non-cancer issues, we only detect them when they already have the diagnosis. But if you have a diagnosis of, like, say, inflammatory bowel disease, there's also early infection, like early onset, or you have also severe infection, or you can also have complications. So you can see that it's kind of like a progression. So if you check it early, technically, then you can give medications, you can bring the condition under control to prevent it from getting into a severe course of disease or prevent complications. Which again goes back to, when do we get this checked? Again, for inflammatory bowel disease, you have different types of symptoms, which is something like bloody diarrhea, if you have it. If you have severe abdominal pain with no good reason.
Runny stools.
Go
running to the toilet 10 times a day.
And some people actually present with extreme loss of weight. Non-intentional, because they keep on having this malabsorption, they keep on having diarrhea. So that's how colonoscopy helps in colorectal issue, where it's in a concept where you pick up the disease in a pre-phase or in a phase where it is early onset, and you could give something or you could do something to alter the natural disease.
Very important.
Yeah, definitely.
Okay, so we've got a question, and the question is, can you share a success story or example where colonoscopy made a significant impact on your patient's health?
Wow. Okay. Again, not to always talk about cancer, but indeed, most of the time it is got to do with cancer patient. So I could share a relatively recent one. We have a patient who was detected to have what we call a rectal cancer. So the cancer is near the anus. And he was seen by another hospital, and he was told that the cancer is pretty advanced and that he needs to remove not just the rectum but the anus, thereby leading to a
stoma.
Very good. A permanent stoma, in fact. So you're gonna get this bag where feces come up from, and that's gonna be for life.
So I think to share with the viewers, I guess it's to explain, it's having a bag that collects all your waste instead of passing it out
Through
naturally.
the anus. Exactly.
Really? So that's the what he's been told. Your patient has been told.
Correct. And then when he saw me again, when I checked him, I felt that it was actually early. It's not advanced cancer as they initially thought so, because there are limitations with even the current state of our technology. Like, for example, commonly we do CT scans and MRI. And the MRI actually said that it could be something like stage 2 or 3 cancer. But when I examined him by putting my finger up in the back passage, it seemed more like a stage 1 cancer.
You can feel.
Well, by feeling, it tells me about how, not just the size, but how mobile it is. And that is a surrogate for how advanced or how deep the tumor has invaded through the intestine. So it's pretty mobile. And I looked at the MRI again, I looked through everything. I think it's one of those cases where it is overly staged by the imaging. So thereby I gave the patient 2 options. One, we could repeat the whole staging again, which will take time and it might delay. Or the other one, we could try to remove the cancer through the anus. And so we did the latter. And it turned out to be early stage 1 cancer. He is now cancer-free, without needing a stoma, fully functional with his anus without any side effects.
How old is this guy?
He's about 60.
Oh, 60.
Yeah.
Okay.
But he's still got a whole life ahead of him.
Of course.
And he doesn't need any more treatment. No more chemo, no radiotherapy, which he was needing if he was treated as an advanced cancer. And so that has dramatically impacted on his life, where he was very thankful that he came and that he managed to diagnose it as an early rectal cancer. And you can see the treatment is drastically different.
Big difference.
And so his quality of life is all maintained by just removing it through the anus.
Okay, so next question is what can patients expect during a colonoscopy procedure?
Okay. So a colonoscopy procedure, we divide it into 3 phases.
Yep.
The before, the during, and the after. All right. So
Okay.
before the colonoscopy procedure, you will have to go through
Bowel
bowel
prep.
preparation. So that comes with some dietary restrictions, but more importantly, you have to drink this liquid to help
Yeah.
clean your bowel. So that can be uncomfortable.
But also depends how far you go, right?
Well, most of the time when we do the colonoscopy, we have to see the whole
Oh.
large intestine,
Okay.
which also means that you need, well, that thing carries your waste, right? So
Yes.
you need everything to be cleared from there.
Okay.
So, well, we have tried to make it not too uncomfortable. That means we try to limit the volume, but also there are some variations in the different bowel preparation. So, like myself, I would usually use the lower volume one so that it's easier to drink. But we tell them also to take
Yeah.
addition of some tablets
Yeah.
so that it helps the intestine to
Yeah.
propel the
Yeah.
waste out.
Yep.
And it is still effective.
Yep.
And more importantly is that the patients find it more tolerable.
Okay. So that's the pre.
That's the pre.
Yes.
Now during, it is done under sedation. So it is a sedative given through the veins. And what happens is the patient is usually completely asleep.
But that's optional.
But that is optional because some patients actually do choose not to have any sedation.
Yep.
And I've also done that.
Yep.
It just carries it with a bit of discomfort that during the scope they might feel a bit bloated because we pump in air during the scope examination so that we could see clearly, but it's not undoable or it's not intolerable. I myself have gone through the colonoscopy without sedation and I know how it feels.
Oh, you're very brave, huh? First one. I heard it's your first one.
Yeah, it
the
is.
The first one that you said.
Well, it's a little bit like like what the doctor says, right? You want to feel how it is like, so that you can know how your patients feel like. Right? 就是以身试药，试药。
我的华语不是差，我的华语是烂。
OK， 好，没事，好，不用紧，不用紧。就是说 what it means is that we will then just do it on ourselves and we understand how it feels and it's actually not that bad. The good thing about that without sedation is that you get to go off immediately.
Yes.
And you don't get some of the side effects like the nausea and the vomiting.
I never had on any of those.
Yeah, so it's really
Some
individual.
people.
Some people do get it.
Yep.
So that's why during the scope itself, I usually tell patients that it's pain-free and you don't remember and you're completely knocked out.
Are we allowed to tell people it's pain-free?
Okay.
Because some people do experience pain, right?
Well, so I would just only say it from my experience.
Yep.
I always ask my patients how they feel after the scope.
Pain-free.
And it is pain-free.
Yep.
So I think it's how you give the sedation and how you make sure that they are completely done when only the patient is like under the sedation and not like done in a rush or not done in a not optimal setting. Because
rush?
Well,
when will you rush it?
Well, sometimes during the scope itself, if the patient is, I would say, not completely fully asleep yet, that means you give them the medicine and you just put it in, then they will be abruptly awakened. And if that happens, then they might have some memories. So I usually take my time to put them under. Then once they're gently down, it's like a plane.
Sayang them a bit.
It's like landing a plane, So when it comes and you're ready to then finally pull the landing gear, then they go down smoothly. So then after the scope, usually they're completely again fine, but some of them, because of the medication, can feel nauseous, and some of them actually can feel that the tummy is a bit bloated because of all the air
that you pumped in.
Exactly.
While
So
pushing it in.
So usually we tell them that you walk it out. When you're completely awake, you can eat some food. We say go light for the next meal. And then really sleep it out. Because after 4 to 6 hours of like resting at home, when you wake up, you find that it's got more than it's back to normal. Very, very few patients actually experience like severe tummy pain or have any kind of side effects, like for example vomiting. Very few patients actually experience that, but if it does happen, all we need to do is give them some medication to help reverse the effects.
Okay, next question is also patient experience.
Okay,
how has technology improved the patient's experience in recent years?
Wow. Okay, so I don't know how recent is recent, but in general, again, we can divide it into the bowel preparation
Yeah.
and then the scope itself. I would say that there are many, many formulations of bowel preparations available.
Yep.
And it is for you to discuss with your doctor what's the
Yeah.
best and most suitable for you.
Yeah.
Because as I mentioned, I do use the lower volume ones to give a better patient experience. However, it is definitely not suitable for all patients. There are some patients who are severely constipated, and that's the reason why they need a scope.
Okay.
Then for those, you probably have to space out the bowel preparation, and you might need to prepare them over a longer period of time, not just the night before, but maybe the day before.
To
you
do
give.
what?
Well, so they do get additional bowel preparation.
Drink more liquid.
Yeah.
Only liquid, right?
Well,
Pills.
water, but as well as pills.
Oh,
yeah.
okay.
Because the truth is that when you go into what 80s, like the
Yeah.
octogenarians, what happens is that they do get a lot more slow gut problems. That means the gut is very slow.
Yep.
And then you might have to give them additional laxatives to help them
Yeah.
clear. Otherwise, if you do the scope, it may become unfruitful. You might
Yep.
not see
Yep,
anything,
yep, just
and you have to
all-
repeat everything. So we try to minimize that. So again, it's very individualized. Then when it comes to any improvements in terms of the scope itself, well, the imaging systems are excellent. Now,
Yep.
last time is high D, then full HD, now 4K. It really helps in the detection. But at the same time, if you talk about the scopes itself, they are all like the caliber is decreasing over the years, and also the flexibility as well is now kind of like changeable,
Yeah.
so that you can try to maneuver
Yeah.
around the scope
Yeah.
in a gentle fashion.
Yeah.
But I think that it's not such a big improvement that everyone really notices, because scope has been around for many decades.
Yeah.
And it's definitely safe. The risk is very, very low. Hopefully it doesn't happen to anybody. But the truth is that in my experience, it is really, really, I have not seen severe complications for many years. And I certainly
Yeah.
don't hope to see
Yeah, of course
any
not.
of that.
Yeah.
So I think that whole experience, if you ask most of the patients who've gone through it, the main thing that they remember about the whole colonoscopy,
Having a good sleep.
yeah, and the
That's
awful thing that they remember is the bowel preparation.
Yeah. Oh my gosh.
They will
Yes.
always remember
all that
how much
drinking.
drink they had, and the diarrhea, the many runs to
But
the
has
toilet.
that changed over the years?
Well, like I mentioned, you still need to go to the toilet many times.
okay.
It's just the type that we give and the volume that we can change it to make it more palatable.
I tell you what was my bad experience.
Okay.
The first time I did it, I had to drink like maybe I say this amount, right? But 4 bottles.
yeah,
4 bottles.
yeah.
I can't even drink on any given day. I can't even drink
Yeah.
4 bottles of water,
yeah.
Let alone that liquid.
which is awful tasting.
But how about now? That was like 7 years ago when I had to do it. Now, same
So
thing.
no, I give different ones lah. I think it depends on doctor lah, actually. Yeah.
Whether
yeah.
you like you or don't like you.
No. It's more about the most typical one that we give is
Yeah.
called PEG, which is Fortrans,
Okay.
which it's the one that's like the safest. It's also the one that's the largest volume. And when I was a young doctor, like 20 years ago, and I've used that. And now that I have so many years of experience,
Okay.
I use something that's smaller, maybe like half of that volume, and I just give them 2.
Okay, so basically just drink one of this.
Yeah.
Really? Just one of this?
Yeah, and you ask them to drink more water by themselves.
Walao, I swear, I drank 4
I know.
of this, you know.
Okay, I myself,
Yeah.
again, 就是以身试药, right?
Okay.
I drank 4 liters. 4 liters
Of which one?
of the Fortrans, the
The
classic
first
one.
or the classic one?
Yeah. I drank it to...
Why?
I want to know how patients feel.
Oh.
Yeah.
How
And,
was your experience? Bad.
not too bad.
Really?
I mixed it with cold water,
Okay.
and so it tasted a little bit more like coconut for me, which, okay, great. But I do get the bloatedness,
Yeah.
because when you drink so much and you haven't passed it out, right?
Yeah,
it's
yeah,
really
yeah,
quite
yeah.
uncomfortable.
Yeah.
And then after that, when you pass out, then you feel, wow, finally it's not so heavy. So I can only imagine how difficult it is for a 70-year-old ama, 80-year-old ape to
Yeah.
drink all this. So that's why, especially for them, I try to space it out. I tell them that I know that it's a little bit more cumbersome, but it's gonna be definitely more comfortable for you, and most of them actually appreciate it.
Yeah.
Yeah.
So on the topic of patient experience, basically from the technology improvement part, what are some of the future technology improvements that you can already see in the process pipeline?
Yeah. Well, very, very interestingly, I think that if you talk about from the patient experience point of view, then I would say not much because the current technology is already very good.
Ah,
Because if we talk about the bowel preparation, certainly not much is changing there. But if you talk about the imaging system, they have like AI.
yeah.
So they use AI to help us detect polyps faster, better, and hopefully more accurate.
Via what? Via the scope?
Yeah, so the scope itself is still the same, but it
Oh.
comes with an additional input to a system where there's already AI generated data
Okay.
that will then tell you that this part of the image looks like there may be a polyp.
Yeah.
This part of the thing
Yeah.
is fine, and then it will direct your attention towards those parts
Which
that
in
has-
otherwise the human eyes may have missed it.
maybe.
Oh.
Yeah.
Okay.
The truth is, this technology is still evolving. Right now, there is no clear benefit. That
Yeah.
means the human eye is just as accurate. But I think over
Really?
time, with more data,
I
you know,
like that.
You know how AI works, right? It's
Yes.
like you give more data and it becomes
Feed it.
even better. I think it might be better. Yeah.
I like that answer. I like how you are saying that today's technology, just by looking at it, it is almost day and night. Whether I can
Yeah.
see a polyp,
Yeah.
it's clear enough.
Yeah.
Good lah.
Yeah, lah, but it's true lah, because maybe also because if you have AI, then you're not so limited by the human limitations.
Yeah.
Because as I get older, I'm quite sure my eyesight will not stay the same.
No.
But so that's
Wouldn't.
why this kind of technology is something that I do welcome. As a surgeon, I don't think it's going to put us out of business.
Yep.
It's just
Certainly
going to
not.
help more.
Enhance.
Yeah, it's going to help increase the detection, the accuracy, and sensitivity of the test.
Mm.
Any other technology improvement? Well, it's more geared towards how do we remove things safely. So if you didn't know, there's also like, robotics, right? We use robotics in surgery.
Yes.
So they're designing, and I was part of this endeavor that they look at using robotic instruments through the endoscope. Interesting.
Yeah, for
In
sure.
fact, one of the local companies actually derived their ideas from the Singapore chili crab. So it's like, imagine that these are instruments that you pass through a scope,
Yeah.
and you come out like crab claws, and you could
Yeah.
pinch onto the polyp or
Okay.
the growth, and then the other one then can cut it. So it gives yourself more control. You can't imagine, because if you
No,
look,
but isn't those keyhole surgery ones identical?
yeah, but now this is all through a endoscope, which the profile of the instruments is way smaller.
Yeah.
Yeah.
Also, you're saying it's coming out of the scope because the scope is
Yeah, it's just
not
one
that
stick.
big. It's just
Correct, and it's a flexible tube some more.
And you're saying that
Just
from that tube, there's a
come out.
camera and there's the
Clap,
arm that
claw,
comes
claw.
out.
Yeah, 2 arms. Yeah, interesting, right?
Wow, like a little shrimp.
Like a little shrimp. Yeah, and
Cool.
those technology are, it's already been used in some countries in part of trials, right? Not great because the UI UX, the user experience is not great yet. So they still need a lot more alignment and adjustments of it. Yeah, yeah. So that's another.
That would be another 10 years.
Oh, I don't know.
Cannot be that long, right?
I don't think so.
3 years.
Yeah, I think something more like that. Yeah, yeah. But certainly, like any technology, it will need to go through the safety checks. You need to get your clearance from the different, like in this case, HSA's
MOH.
approval, HSA, Health Science Authority approval, things like that. Yeah.
Not MOH.
No.
I only know MOH.
Yeah, I know.
Yeah.
Most people know MOH. Very good already. 很窄了，很窄了。
Okay, so what are the most common misconceptions or fears associated with colonoscopy?
Oh, wow. Well, actually, I think one of the biggest one you might know before you do your first. What is your most common fear? What's your
Pain, lor.
most- Yeah, lor.
Oh, yeah.
Most
okay.
people actually feel that it's very painful,
Yeah.
which you know,
No.
and I know.
For me, lah, at least.
No, I know. I mean,
No,
like I
no
told you, all the patients that I ask, no, they don't
Yeah.
remember. No pain at all. Yeah. So in fact, that's one of the biggest myth about colonoscopy. That it's painful? No, it's not. It's just as simple as that.
Let me guess the second one.
Okay.
Cost.
Okay. Yes.
Soon.
Yes. They will think that it's very, very costly.
Yeah.
Cost an arm and a leg. But as we mentioned before, all the data is available. That it's usually you can claim from MediSave, you can use insurance, shield plans, and all. And honestly, even if you do it at a private hospital or a setup like this,
Yeah.
the cash out of pocket can be just a few $100s. Everything else is taken care of. Yeah, and it's really I mean the benefit is way more efficient than the amount of the small amount of money you put in. Yeah.
Yep.
The other myth that you
Myths.
have about
Myths.
colonoscopy is that, oh, I'm too old for it.
Really?
Oh well,
Which
some
is,
patients
which
who
is
are,
the exact opposite of what people should be doing. Because
Yeah.
the older you are, the
the
more
higher
you need to
risk.
do it.
But we have patients who are 80 plus,
Okay.
and they say that like I'm 80 plus, do I really need a scope?
Oh, that's true.
It's true, right?
Will they say
对
that?
对对，他们
Yeah.
讲的，哎
顺其
呀，
自然。
顺其自然哦，我不要
Yeah.
知道更好。
Yeah.
Exactly. But actually, age is a relative marker of I would say contraindications towards scope. That means if you're 80, doesn't mean that you shouldn't go for a scope.
Yeah.
If you are 80 and you're fighting fit, you know, you're active, you run marathons, or you just go out of the house.
Sorry, did you say you're 80 and you run marathons?
Example.
Okay. Yeah.
Giving extreme examples.
Okay, yeah.
Clearly, you're going to be fit for the scope. But if you're 70s and you have multiple medical problems, you are barely communicative because of a stroke or other heart problems, then you see, then
Furthermore.
age is not the problem. See, it's
Yeah.
all about your other comorbidities that makes it so-called the contraindications for scopes.
Yep.
Most of the time, scope being a very simple, fast, easy procedure, there are very few absolute contraindications for scopes, and no one is really too old for it.
Yep.
Yeah. I think those are the key myths. If you talk about other reservations people have, is that actually even amongst the young people, a lot of them have that same mentality, the fatalistic view of like, cancer is non-treatable. If it happens to me, then it's fate and I should die. So
Yeah.
when you tell them about early detection
Yeah.
saves lives, to them it's like, no lah, bullshit lah.
Yeah.
I'd rather not know.
Yeah. Do you in your line of work, right?
Yeah.
Many years of work.
Yeah.
Do you feel that the older generation or like in the past, people
Yeah.
feel like I don't want to know, I just die.
There's more.
And
correct.
now the younger generation are like,
Yeah.
find out now.
So actually it's backed by science data. We actually did research. I actually championed some of this research before, and we look at all the barriers towards colonoscopy.
Yeah.
And amongst all age groups, there is that common theme of the fear of the unknown or the denial.
Yep.
Right? They rather not know.
Yeah.
And amongst the older generation, there's a slightly increased predominance of that mentality.
Yep.
I think that has to be balanced with also about the cost of living. See, when that generation, when they were young and everything, they were told to just work hard, just save every cent you have. And once to come to that age, even if they're target risk, they will feel that, well, as long as I've worked hard all my life, there's nothing else that I need to worry about or I should spend on. And so they really don't spend on themselves.
Yep.
And when
they're afraid that all their life savings that they saved up for their children, grandchildren will all be just wasted onto that.
Correct. So that's actually a barrier for them to come forth to take charge of their health, which is something that, yes, even as a son, for me to convince my own parents to come for the scope,
no, have they gone?
They have, thank God.
Yeah, I mean,
Took me
you're
like-
the doctor, you know.
Yeah, it took me like months. Well, you know, it's like you cannot imagine how hard it is. So, but you can if you've tried it before, but it doesn't really mean anything less to keep trying because the benefit is so much greater. Okay, with my own parents, when they gone for scope, I won't share the details, but one of them actually had diagnosed something, and thankfully it was stage 1.
Really?
And she got treated.
It wasn't benign.
It wasn't. Yeah. But
Wow.
treatment was started promptly, and thank God that she went for it. That was that was it was like a saving grace that I persisted in telling them to go for scopes.
Your heart must have sank when you found it.
Well, yeah, when I was doing it, I actually prepared myself for it because
Really?
she had symptoms.
You were in charge of the operation.
The scope itself.
The scope.
Yeah.
I thought they might say, hey, look,
I've-
own family members. you're not
So
allowed
there's no professional the barricade for that.
Okay.
It's very personalized. or rather, I would say it's up to the individual. So for me, well, that keen of mine would say that very comfortable if I was doing it. And since she didn't want to do it in the first place, and so I said, yeah, I would love to do it. I think it's, I mean, personally, this has to do with my Christian values. I think it's very good chance that any child could give back to their parents. And since I could, I don't feel the barrier. So I did it. And when we found it was stage 1, wow. I mean, I was just very thankful that, we got it promptly treated and disease-free right now. Yeah.
So in that same situation, fast forward 3 years, didn't check something.
Definitely.
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 Right? Wow. So happy for you, man. When was this? Last year?
Thank you. Thanksgiving. No, many years back already. It's almost 7. If I count correctly, it's about.
So
7.
now they still go for scopes every 5 years.
Okay. So for her, it's quite special, right? So,
What special? You give her every year.
No.
Special price.
That would be no. Now we do it 5 years still, but
okay.
Beyond which she doesn't need that scope again. Yeah.
What do you foresee as the future trend in colorectal health and preventive screenings?
Okay. So future trends has a lot to do with the community health behavior as well as the policies, and I would say also because it's so tightly bounded to the financial system, so the financing system in Singapore. So if we look at behavior, I think that the increasing efforts of public education is really going to be helpful. I would foresee that most people are very much aware, and so now it just needs the finances and the policies to let people go and take action about it. So I think that I do think that more and more people will come forth for screening, and they will all be hopefully with the healthier SG efforts, they will all be more encouraged to do all the good lifestyle measures, and we should see a better trend. That means a decreasing trend of serious diseases, as well as an uptick in the earlier diagnosis. That means conditions being detected at an earlier stage, and thereby hoping to lead to a better natural cause of disease. That means you're going to get less mobility, you're going to get patients who are treated early and they don't get complications. So then where are those policies going to be? If you see it, it's not just about what we get access. That means earlier access. I think they're talking about a lot about direct access to scopes, whether patients who are seen in polyclinics, you can get a direct scope so that the time to scopes becomes more efficient and shorter. Now, if you look at the current state,
2.5 months.
More easily 3 to 4 months before you get a scope. So, especially when it's a non-urgent basis. Hence, that's why you need a lot of not just planning, resources, but you also need scope centers to be like fully equipped. That means they're going to have enough for people to keep on running them, and on top of that, financing must be supporting such efforts, because ultimately when you put in so many, I would say that the endoscopies, facilities and things like that, you need to be properly financed so that you will get people who are able to go for these scopes without much interruptions. More than,
because the last thing you want is for them to want to come, but when they come, like, there's not enough beds. You gotta wait 4 months. When they are interested, then 3 months later, you know what? 我不要做了。
对 exactly. 真的 So that's why I think the trends are in general very positive. But however, I think we hope to see more of this kind of changes.
But the infrastructure can keep up lah.
Exactly. I mean, everybody is looking at like the cost of living now, inflation and everything. So if we don't keep tightening our governance in those areas, then it's very likely that the first thing that goes out people's mind is that, well, I've got to work. If not, I have no bread on my table. What am I going to do about health? I'll just leave it to chance. And that would be very bad. Because if you study health economics, if you didn't know anything about like what is it that costs the society most in terms of health disease burden, it is all your severe conditions, your major cancers, late detection of all these conditions. So for the society at large, it's definitely better to do all the early detection and prevention.
Yeah,
'Cause in
which
the long
costs a
run-
lot more, less
Yeah,
time and costs, I
a
mean,
lot
dollar
less.
wise, a lot less
Exactly.
also.
Correct, exactly. And that's really how to effectively reduce the economic burden, is to do more and more of these preventive measures.
Amongst the ranking of
Mm.
government priority on cancer, which is there a hierarchy of which the government
Which
is
cancers
focusing?
are? Which cancers are? No, actually, they look at things at a even more a bigger scale.
Yeah.
They would say that amongst the major diseases like cancers versus diabetes versus heart diseases versus strokes and versus the aging population like dementia problems,
Oh my gosh,
which
yeah.
one is a bigger burden?
So
So-
which is there one?
Well, these are the things I mentioned are usually the major ones.
Okay.
It does changes from every few years.
Okay.
They kind of like repatherize.
Yeah.
Yeah, but cancer is always there. No
Okay.
matter how, like, I mean, if you know, remember a few years back, it was like the war against diabetes. So they
Yeah.
put a lot of things on diabetic screening,
yeah.
which major things you would think like they will screen the eye because diabetes has a lot of effects. So they will check for cataracts, retina problems. They will ask them to actively not just screen their blood,
Huh.
but also check their kidneys, check their other organs.
Okay,
So
this I'm not very aware actually.
yeah, so
Yeah.
these are population health
Okay.
efforts.
Okay.
So that's why for government it takes a lot of resources and planning to say that okay, we
Yup.
prioritize this over that. But cancer is always amongst the top three. It's always there because I mean with aging population, cancer is just going to go up. Say yeah, yeah.
All right. So final question. So
Yes.
where can listeners find out more information on and resources on colorectal health?
By listening into this podcast.
Okay, this one. Any more?
Well, the truth is that I think most people are very tech savvy, and you can easily Google the major websites. I mean, going from Singapore's perspective, Health Promotion Board has a website that you can tune into. You can actually look at all the different types of resources that's available. They have not just pamphlets; they have where to go if you are
Yup.
interested in any kind of major diseases, preventions, and screening. Then actually all your other polyclinics
Okay.
actually have a lot of those brochures,
Yup.
and they regularly hold campaigns and also events about different types of screening.
In the polyclinic.
Yeah.
But no one's gonna just randomly walk to a polyclinic and
You're right. It's not like
Yeah.
a playground or it's not
Yeah.
your shopping center, right?
Yeah,
But
yeah.
the truth is that I mean,
and also
even-
nobody just randomly grabs the pamphlet like, hey, let me read this. Colorectal
Well-
health.
Well, the truth is there's a reason why the waiting time in polyclinic is so long, right? So since you're going to be there, right? You know what? Just pay attention a little bit more to everything that's
Yeah,
hanging
and
around
we
you.
could have seen you in 1 hour, but
But
we want to hold you here for 4 hours.
I didn't say that.
Typically, you'll
that's
walk
from the
around and read.
podcast. Yeah, that's not me. But clearly, that is a rich source of information and reliable information. Because you don't want to really take things off Google. Well, no harm.
Yeah.
But actually, there is. It causes a lot of anxiety.
Oh,
Most people
Me,
who
for sure.
come to me,
Yeah.
I think most people who comes to any doctor with a lot of Google tags and oh my gosh.
Can only imagine.
I mean, we could really do with less
Yeah.
anxiety from those
I got
channels.
tummy pain on my bottom right. It
Nah.
says that I got stage 4 cancer.
Yeah. I mean, yeah, there's a lot lah. And people will ask about esoteric cancers that we hardly ever see, but it does appear as one of the possibilities.
Izu what?
Esoteric. That means like so uncommon, so rare.
Oh.
Yeah, so I would say that this official channels, HPB, the polyclinics, your neighborhood doctors,
Yep.
doctors that you know, these are or healthcare providers,
Healthcare providers. Yup.
nurses,
Or maybe your friends
yes.
who have gone through something similar.
they become literally the best source of information or correct information. The other
Oh, that's
things-
true. Correct information is more important than just
Just
spreading
information.
information.
Exactly.
I better not open my mouth too much because
No, it's okay.
I better be spreading proper, correct information.
Well, you are right now.
Hope so. With you, I am.
Thank you. But we have also like those kind of campaigns we did mention before, like Colorectal Cancer Awareness Month, which is coming in March,
Yeah.
right? So in March itself, that month, you will see a lot of efforts where there will be public talks and there will also be things like feed kit distributions, and if you are not aware, there's also like cancer societies who will run events. Like in Singapore, there's Singapore Cancer Society, there's a Colorectal Cancer Society, Singapore Colorectal Society, and there's also gastroenterology societies who will run events, and a lot of these events are targeted towards the public.
Yeah.
So again,
Where
focusing,
are they usually?
well, I don't know them right now because
Usually, like, are
yeah.
they polyclinic again?
no.
Okay.
They actually hold talks like sometimes in like even like hotels, like lobbies. Yeah, and sometimes in
Who goes?
clubs. So usually the marketing is done by like the event organizers.
Yeah.
Like, okay, for example, I get invited to talks that like sometimes in country clubs.
Yep.
Or offices, like for example, this organization, it could be a bank.
Yep.
They're like, oh,
Ah.
they want their employees
Yep.
to be aware. So I go and give a talk.
Okay.
And then once they know about this information, then they go and get their feed kit, or they come for a colonoscopy. And so all this, then we give them extra information as on a need basis.
Yep.
Yeah. So these are all possible venues of information.
MNCs, SMEs, they would
Yeah.
probably get healthcare workers to come down and spread the word.
Yeah.
Do they?
Actually, yeah. I've given quite several of these talks.
that's good.
Like, even last year, I given like more than 10 talks. Yeah, because okay, so we mentioned about the financing system in Singapore briefly, like you know how insurance and all this is tied. So actually, insurance companies and a lot of your financial advisors,
Yes.
they actually get talks for their clients. So they actually have health related talks, sometimes financial talks,
Yes.
and then they invite like doctor like myself, and I'll go there, and they will hold like in a ballroom of table of
Yeah.
like
It's really smart for them to do it, you know.
well, I
Right?
don't know.
Because
Tell me,
because when financial advisors or for example insurance companies,
Yeah.
when they host a talk like that, their clients
Yeah.
will then spend the small money to do their early detection,
Yeah.
and therefore preventing the big payout,
Oh yeah,
which is a win-win for everyone.
that's true. That
Yeah.
is true. Wow, I didn't think about that. I do think that it is very helpful in the sense that like when they are more aware about how early detection is good, and when they don't have a policy that covers early cancer, so that's where the financial people also so-called sell their products. But in a sense, it's also a win-win because if the more patients who are covered or well covered by the insurance, it also takes away one of the other concerns they have when they're eventually diagnosed with cancer. Right? Can you imagine if you're diagnosed with a disease
Yep.
and you still got to worry about not just your health, you got to worry about how to pay for it? It's like, you know, like 真的是雪上加霜. That means you burden over burden. Yeah.
I certainly don't look forward to that.
No, neither do I. Yeah. So I think those are the sources of information that we could get. Yeah.
Ladies and gentlemen, I know you've got more questions, but that's all we have for
Hey.
Dr. Chong. Thank you so much for being here with us again.
Again,
And
thank you.
if you guys got more questions, write them in the comments below, and we'll see you soon.
Okay, take care. Bye.
Bye.